The steps to take to manage your asthma are clear. Take a preventive medication, carry emergency medicine, know what can trigger an attack, and do whatever you can to avoid those triggers. So let's say you're doing all that. Is there something extra you could try? An additional treatment that has nothing to do with doctors, drugs, allergens, or dust? Here's HealthBeat's Sherry Carabin with a question. Can your symptoms be eased using an ancient technique that's all in the fingertips?
Deep breath in, and out through your mouth.
Marilyn Nard suffers from asthma.
I was born with asthma.
As a child, it prevented her from taking part in sports. As an adult,
It can be very painful and distressing at times when you are trying to complete a task and you have an asthma attack. If I go somewhere and I forget my pump, it can be very stressful.
but on this day, she's decided to try a different type of therapy for her condition, undergoing a shiatsu massage at Gardner Chiropractic and Wellness Center on DeKalb Avenue.
That's the energy caught up in the joints. And it's just going to work itself right out.
Kimathi Card has been a licensed massage therapist for about 7 years now, practicing both Western and Eastern techniques. He uses shiatsu massage to treat his asthma clients.
My approach is mind, body, spirit. So I want your mind to be connected with your body and your spirit to be connected as well.
Card is also what's known as a Qigong master.
It means that I have the ability to move energy with my hands. And everybody's experienced it. If you've been in a room and you felt somebody looking at you, you're feeling their chi.
While Nard has gotten massages before, she's never had one like this.
This is an Eastern approach. This is going to be something a little bit different. There will be a little bit of discomfort involved, but I will let you know when that's going to happen. Up until then, I just want you to relax and enjoy it and just feel easy. I heard you say before that you felt like today's a good day, but I'm going to show you what a really miraculous day is. You feel how tight that is?
Yes, I do.
I definitely can buy into the idea that massage can help duration of asthma, the symptoms, their frequency of exacerbations.
Dr. Elena Klimenko is an integrative medicine physician in Manhattan, practicing conventional and alternative therapies. She's also a consultant at Brooklyn's Lutheran Medical Center.
Qi is the life energy or life force, and their free flow of qi through their meridians or channels will provide a healthy and normal bodily functions and organ functions. If the qi doesn't flow freely, then the symptoms occur and disease can happen, and asthma can be an analogy of that.
I treat the asthma by strictly directing the energy towards the lung and large intestine meridian. A lot of people don't realize that your lungs actually go all the way up to here. So if these muscles are that tight, there's no way that you're breathing properly. It's like somebody stepping on top of a balloon.
How effective were Kimathi's techniques on Nard?
I didn't even realize how tense I was until I'd had this massage, and I didn't realize how I was struggling to breathe. I do feel more upright and able to breathe easier than before.
Mm-hmm. 4-year-old Kyle Montgomery has undergone massage therapy several times since the spring of 2006, and his mother says it's helping to improve his asthma.
Actually, my girlfriend is a masseuse, and she introduced me to Kimathi, and she was talking about the great things that he was doing, and we tried him out. For the first session, he actually healed Kyle right in front of our eyes. He did some breathing techniques with him and also some massage techniques. And he also showed me some techniques that I could do at home. His asthma is pretty much triggered by colds. So usually he gets colds like change of weather type of thing. And we would use it at least 3 times a month. And for the first, when he first worked on him, maybe we used it maybe once per week. And he was actually sick at the time that he worked on him. So now we're not using the nebulizer at all.
But can massage really help patients to give up their medication altogether? This allergist at Long Island College Hospital in Brooklyn is skeptical.
There are many reasons for improvement in a 4-year-old. Simply outgrowing asthma, not the typical age, but could be. Environmental measures, treatments. Can it have a beneficial effect? Yes, but are there other things going on? I don't know. The studies that have been done have had mixed results. And what we found is that the effect, if it's there, is probably more of a placebo effect.
Dr. Klimenko has a different take on the matter.
For the mild asthma, having a periodic massage done can be sufficient to control the symptoms, along with other lifestyle modification, quitting smoking, controlling normal weight. If we're dealing with a very severe asthma with daily attacks and a history of hospitalization, probably conventional medicine will control the symptoms in a much better way. But as an adjunct therapy, I'm definitely recommending it for my patients.
She's pouring out of you. And breathe. And out.
At this point, I wouldn't discount the effects of massage, but I wouldn't use it as a sole line of treatment. I would have a patient on conventional medical treatments as well.
I'm going to connect these 2 points, and this is really going to give you a nice jolt. Breathe in.
While Nard isn't planning to give up her medication, she's not ruling out adding massage to her treatment regimen either.
And if this is a possibility for helping me with my asthma, I'm definitely going to investigate it, because it's indescribable.
That's real tight in there.
This is Sherry Carabin reporting for HealthBeat Brooklyn.
That's all for this month's segment of HealthBeat Brooklyn. We'd love to hear your comments, questions, and story ideas. Please email us at healthbeat@bcat.tv. Thanks for watching, and stay healthy.